All right, you heard my warning again and again and again throughout this whole process, from legislation to law, and a major health care promise broken then. I said it repeatedly then. I say it now. If America had known in the beginning that you can't keep your doctor, would the health care law even have become law? Jessie Jane Duff and Emily Sussman here to clash it out. Jessie, that was my only point then, as it is now. Things that sound too good to be true generally aren't.
Oh, I'd have to agree. You know, whenever somebody tells you they'll give you something for free, you better look around the corner because you're going to have a high tab associated with it. We're looking at 14 million people that will be projected to lose their individual health care. And this was in the Obamacare regulations. It was there. He has stated since 2009 all the way up to 2012, oh, don't worry, you will not receive a cancellation. And now we're sitting here looking at being lied to by our commander-in-chief.
Well, you know, Emily, I'm going to give the president the benefit of the doubt that I don't think he deliberately lied. I think he was confident that this would be a migration to this and all would work out. But clearly the Steny Hoyers and the Nancy Pelosi's had a sense that there would be some bumps along the road. Their public statements have said that. So I'm wondering if, knowing what we know now, about people who would be dislocated, about the full-time workers who become part-time, the part-time workers who lose all their work time, that this would have sailed through by the party line vote it ultimately did.
Look, I think Americans were ready for a change in the healthcare system that we have. I think the plan as it was just really not working for a lot of people. A lot of people were postponing going to the doctor at all, and by the time they went, they were too far along to be able to get coverage, or if they could get any kind of coverage, it would put them in serious financial difficulty. So people were ready for a change. This was a change that came forward, and a lot of the proposals that came forward from the Republicans were really just not serious proposals.
But do you think that these changes and that this looks better than what they had? And I think I could bicker with you on that, but I'll give you the benefit of the doubt on that. Do you think that this would have even come as far as it did had people known that it would be half the hassle that it ultimately turned out to be?
Look, you know, the president shouldn't have said, you can definitely keep your plan. What he should have said was, most people can keep their plans, and I think that's what we're seeing.
It would have never passed, Emily. It would have never passed, right?
So I do think that it would have. I think that people are seeing that they can get coverage where they couldn't before. You know, even when they're getting plans that are, when the insurance companies are sending them letters that they're canceling their coverage, they shouldn't be saying that. They should be saying you have other options. You can go into the exchanges.
Well, yeah,
so
you can pay a lot more. I see what I think. You're right. I mean, a lot of people, there's going to be a guarantee you'll have coverage. There'll be something there for you.
Yes.
You can move to these other or transition to these other plans. But Jessie, my point there is, yeah, and pay through the nose for it. A lot of folks, and we've had dozens of them on this show, on all my shows throughout the months on this very issue, have discovered that if they want to keep their doctor, keep their plan, if they're so lucky, then they're going to have to pay dearly for that. And they're seeing big premium hikes. Another reason why I say this would have never passed had they known that.
Mm-hmm. Absolutely. There are families right now that are too high of an income bracket, and their deductible will be $13,000 alone. I think it's very indignant to say, well, you have other choices. We were told you could keep the choice you had. Look at the VA medical system. It is destroying our medical care for our veterans, and this is what we want to duplicate. I think it's appalling that anybody would suggest we have an alternative for you even though you were canceled. I was happy with my plan. Those 14 million voters out there who are going to get cut, I guarantee they probably wouldn't have voted the way they did.
Well, obviously now we have to look past the initial bumps, and we're told that give this time, it's going to stabilize. Like any big government initiative, it takes a while, and I'll give the benefit of the doubt even to that. But Emily, what I'm asking you is, a year from now is when some of the other icky stuff kicks in, and that is that employer mandate. And we just had a guest on who said that it's going to be its own little kettle of problems. Do you think that this is a years of getting adjusted and getting angry American electorate?
Look, I think in this, in the age of social media, when people, you can turn things over in a news cycle. This has been bumps in the road. We both agree on that. Ultimately, people are going to hear from their friends and family. That's what's actually going to matter. Were you able to get covered? Were you able to, where you weren't before? Were you able to go into the exchange and find a similar plan for a lower monthly rate? I think that's the thing that's going to matter. And so I do think when we look to a year from now, people are going to be remembering who brought them this health care plan that is actually helping them.
We shall see, ladies. I don't know. It's a bumpy ride, but we'll see how it goes. In the meantime,